Hi and welcome. I am trying to learn medicine. Today, amputation, and amoebiasis. So together, amputation and also second chapter, amoebiasis. No. Amyloid disease. And after we've done what we're gonna do, we're doing squat training. And if you participate in the squat training, then it's better your arms. And we're talking about internal anatomy, amputations, and this is no medical advice. We're just reading about. Then again, this is separated. We're doing first amputation and then separate from that is amyloid disease. So amputation. The removal by a surgeon of a diseased part of a limb or organ of a body. So an organ removing is also amputation. Diseased part of a limb or organ of a body. But there are not so much which can be taken out. An amputation is normally performed to prevent the spread of infection from diseased to healthy tissues. It would be interesting to know how it is even spreading. An infection. Or to remove a structure that cannot carry out its usual function, in order that an artificial substitute or prosthesis may be fitted. That is an interesting thought. Okay. In order that an artificial substitute or prosthesis may be fitted. Okay, we have that all together. We need all these medical terms. An amputation. We want to make a video about it in this film called Medical Term Amputation or something like that. And then we have all the other ones also together like that. All in one now. So amputation is the removing by a surgeon. It's the removing of a diseased limb or organ. Of a diseased limb or organ. And it is normally done to prevent spreading of an infection, or also to remove a structure that does not or cannot carry out its usual function, so that an artificial substitute or prosthesis can be placed. Okay, amputation, that is done by a surgeon. Amputation is done by a surgeon. Amputation is done by a surgeon. It is the removing of a limb or an organ, because to stop spreading, to stop enlarging, to stop spreading of an infection of a disease. Normally performed to prevent the spread of infection from disease to healthy tissue. It's done to prevent the spreading of an infection from disease to healthy tissue. To stop or prevent the spreading of an infection from disease to healthy tissue. Or if there is a structure that is a key term, we're going to use them. If there is a structure that does not carry out its usual function, in order to place an artificial substitute. I'm not really familiar with the term substitute. Artificial substitute, so it doesn't mean anything to me. Artificial substitute, prosthesis. To place an artificial substitute or prosthesis. Let's try. I'm going to start the same camera. En sogar Fahrrad. Amputation. An amputation is done by a surgeon, and it is the removing of a limb organ. And it is done to prevent the spreading of infection from disease to healthy tissue, or if a structure is not carrying out its function, to place an artificial substitute or prosthesis. And that is according to Keith Hodgkin's Family Medical Advisor, page 72, but this is no medical advice. I'm going to stop the camera. And actually, it would have been enough for medical part. But we're having time left, and we're having here amyloid disease. Amyloid disease. A disorder in which an abnormal, wax-like protein called amyloid invades the tissue of internal organs. Okay, that thing is not a disorder, it's a disorder. And there comes a protein which is wax-like wax or like a candle, I think you know what I mean. And it comes for some reason into the internal organs, and it should not be there. And it's just the wax-like protein which invades and settles over there is called amyloid. The disease sometimes occurs as a complication of prolonged infections such as tuberculosis, prolonged inflammatory illnesses, such as rheumatoid arthritis. I still get this. Is arthritis, are two different things? Rheumatoid arthritis, or certain other disorders, including Hodgkin's disease. Okay, it can come as a complication out of tuberculosis, rheumatoid arthritis, or Hodgkin's disease, or prolonged inflammatory rheumatoid arthritis or Hodgkin's disease. In other cases, amyloid disease occurs in isolation. The organs most commonly what is isolation? Do we mean it happens just without another just without being brought about by another disease? The organ most commonly affected are the spleen. I don't know what the spleen is. I think I heard it one or two times, but I have no idea what it is. The organs most commonly affected are the spleen, liver, and kidneys. Okay, the liver is here, the kidneys are here. But I don't know what the spleen is. When the disorder is secondary to some underlying illness, treatment consists of controlling that illness. In other cases, amyloid disease occurs in isolation. I don't understand the sense, but I think it means it happens without anything. We have actually 2-3 minutes left. Let's look if we are able to make it as a video as well. Amyloid disease is a disorder in which an abnormal, we don't say it is an abnormal amount, so it seems to be at all abnormal. But it will be interesting if this amyloid has use at a proper place and a proper amount, in which an abnormal wax-like protein, we don't say that it is abnormal amount, so we're going to say just the way. Maybe there are proper uses in the human body for amyloid, maybe not. Again, it's not medical advice. Okay, amyloid disease, by that wax-like protein called amyloid invades tissue of internal organs. It can come as a complication of tuberculosis, rheumatoid arthritis, or Hodgkin's disease. And most affected are spleen, liver, kidney. Maybe you're going to say treatment consists of controlling the disease which has brought it about. I'm going to start the camera and let's start. Let's try. Amyloid disease. Amyloid disease. Amyloid is a wax-like protein which by amyloid disease invades the internal organs and stays there. And it can come as a complication out of tuberculosis, rheumatoid arthritis, and Hodgkin's disease. And most affected are spleen, liver, and kidneys. And if it is as a complication of these 3, for example, diseases, then the treatment of these diseases is the treatment of amyloid disease. And that is according to Keith Hodgkins, Family Medical Advisor, page 72, but this is no medical advice. So if I look at one little thing I said, and it stays there. A disorder in which an abnormal wax-like protein called amyloid invades the tissue of internal organs. I didn't know it stays there for 40 years. I mean, it stays there, it is there, no, it is there. So I think I'm going to take it like that. I'm going to stop the second camera. And yes, this is, I understand it like that. So I said it as I understand it. But it comes into the internal organ and not just comes in it and goes out again, like a hormone or whatever. Now it goes there and it stays there. It goes into it and it stays there. Whether it's not for 3 days or 3 months or 30 years, whatever. It stays there. That's not just. Now, I said what I meant, and if not, I understood it all. Now, that was a medical part. If you are here for medicine, you can go directly to the next part of medicine. We will do now the squat training. If you stay and participate in the squat training, then it's better at your own risk. And we're starting with bringing one leg up and with pointing the foot down. Move it up and down. And circle the foot. And in the other direction. And the other foot up. Point the foot up. Move it up and down. And circle the foot. And now we'll try and stop. And with one leg, point the toes forward and use the chain of the leg. And to the other side. And now the wind is going side to side. And now let's do some squats. We're doing 12. So legs wide apart. We're going down. Also the first one, then the second one, and the third one, and the fourth one, and number 5, and 6, and with 7 we have already over the half 8, and 9, 10, and the last 2, 11, and 12. And now the 6-pack squat squeeze. Legs wide apart. We're going down into quarter squat and press against the top of the upper leg. Only on one side. And now on the other side. Go down into half squat and press club in the middle of the leg. And on the other side. And down into 3/4 squat and press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water pond. Down into 3/4 squat, press against the knee, go towards it. Again on the other side. Press against the knee, go towards it again. And again. And again. Last 2. And up. And last exercise already. The propeller down into full squat, arms to the side, over to one side, press against the leg, do it. The middle out to the other side, press against the leg, up to there. The middle, up, and up it's stretching to a walk with. And one knee up for crane again, one foot down, other leg up. Mushroom. Now the crane. Take the leg as the ankle. Make it straight back. Point of the knee down to the ground. And the other leg. Take the leg as the ankle. Make it straight back. Point of the knee down to the ground. And legs wide apart. Breathe in. And out. Breathe in, close the legs. And breathe again out. That was the squat training. Thank you very much, and have a nice time.